Hospitals and first responders continue to be stretched thin. Arlington County is turning to a virtual alternative with the hopes that it will lessen ER visits and cut costs for certain patients. WDVM's Christy Matino tells us more about this emergency telehealth pilot program.
Starting this month, certain Arlington residents will have the option to skip the ambulance ride and trip to the hospital, with the option to be seen virtually by an emergency health physician. When Arlington residents call 911, they will now have the option to have the hospital come to them.
It's a wide diversion away from the traditional model, which is you have two choices when we show up. You can either sign a refusal that you don't want to go, or you have to get in the back of the ambulance.
The pilot program, called Emergency Triage Treatment and Transport, or ET3, allows EMTs the ability to video call an emergency room physician for conditions considered non-life-threatening.
When you call 911, our providers on scene will do an evaluation, and if appropriate, they can initiate a telehealth call with what we call a qualified health practitioner.
The program offers other alternatives, such as bringing patients to an urgent care. And Dr. Reed Smith from Arlington County Fire and Rescue says the new initiative creates equity within the county.
There are people in our community that are afraid to go to the hospital because of financial reasons, or they're afraid because that's where COVID is. If someone doesn't want to go to the hospital for whatever reason, and we just say, well, sign a refusal, then we leave, you didn't get any care. Now we can say, well, you don't want to go to the hospital. Can we bring the hospital to you?
And the option for telehealth and urgent care visits means less strain on emergency services.
It allows us to get our units back in service, because sometimes when our units get to the hospital, when the hospital is very, very busy, we have to wait for the care to be transferred to the hospital staff.
And the county has hired a total of 8 healthcare practitioners to answer these telehealth emergency calls 24 hours a day, 7 days per week. In Arlington, Christy Matino, WDVM 25.
Arlington is joining neighboring Montgomery County, Maryland, and Washington, D.C. in offering this telehealth alternative.